Hello and welcome to this Institute for Government event looking at what role should modelling play in a crisis. I'm Gemma Tetlow, I'm the IFG's Chief Economist and I'll be chairing today's event, and welcome to all of you both in the room enjoying our air conditioning on this very hot day and to all of those of you watching online as well. And we're delighted today to be partnering with the Forum at Imperial College who are kindly sponsoring this event. Modelling and forecasting played a prominent role in the way policies were designed and decisions were made during the COVID-19 pandemic. But the government's handling of that crisis raised questions about how modelling, both epidemiological and economic, was used by ministers. And that's what we want to focus on here today, exploring the role that modelling can play, what it did play during the pandemic and what role it could play for future crises. And to help us explore these questions, we have an excellent panel of experts. On the far left, we have Ruth Kelly, who's the Chief Analyst at the National Audit Office. We then have Professor Neil Ferguson, who is Director of the MRC Centre for Global Infectious Disease Analysis at Imperial College London. Joining us online, very topically, still on the recovery from having COVID, is Ben Chu, who is Economics Editor of Newsnight. And on my right is Richard Hughes, who's the Chair of the Office for Budget Responsibility. Just a few brief housekeeping things before we get started. Please do start sending in your questions while we're going through the first part of the event. If you're watching online, you can do that via Slido. Please do tell us your name and where you're tuning in from if you're happy to, because it's always interesting to know who we're talking to. And if you're in the room, then obviously feel free to use the traditional method of putting your hand up when we get to that part of the event. We'll be live tweeting this event from the @IFG Events Twitter account using the hashtag #IFGForecast, so please do follow and tweet along. This event is on the record and the video and audio recording will be available on our website within 24 hours if you'd like to listen back or miss any parts of it. So, Ben, I'll kick off with you. To what extent did communicating the results of highly uncertain epidemiological as well as economic models to the public during the pandemic present new challenges for you?
Well, Gemma, I think it did present a lot of new challenges. I'm sorry I can't be here today. It's a stubborn red line on a lateral flow test. But if I can I go in on the really big question, I suppose, for me as a representative of the media, of how should these models be communicated to the public? Because that is something that I have grappled with a lot over recent years. And I think I would start with actually a place where the media needs to understand the political environment in which these models are going into. Because I think there are sadly bad actors out there who attack models and attack modelers. We've seen a lot of that over the recent years, essentially because they don't like the results, not because they don't like the science, because they don't like what the models suggest. I don't think changing the minds of that group should be a priority, actually. I think it's other people. I would say the majority of people who don't have an ideological position on this, on any of these given questions, but are perhaps just a bit confused about the terminology and about what models are. And I think it's important to try and reach those people. That's what I try and do as a member of the media. So how do you do that? Well, I think there are three rules I would suggest, and I'll just briefly go through them, Gemma. I think the first one is that, and this applies to economic modelling, I think it applies to epidemiological modelling. I also think it applies to things like climate modelling as well. And I think, first of all, the language really matters. And I think when you're talking about the results of models, it's really important to say not this will happen, but the results suggest this could happen under plausible scenarios. And now that might seem sort of splitting hairs talking about language, but I think it really is important for building understanding among the general public about what models are and what they're not. You know, they're not firm forecasts of what is going to happen, but they are plausible, probable, possible scenarios. Second one, very briefly, is that caveats really, really matter in communicating models. And I take this to heart in my reporting. So when you're talking about the results, you need to show these are results based on certain assumptions, X, Y, Z.
Ben, I'm very sorry, we've just lost you there. Neil, are we going to get Ben back? We will? Okay, great. Ben, if you could just pause that thought and hopefully resume where you were when we just lost you, which I think was just saying number 3.
This needs to be reconnected.
Okay. In that case,
well, I will pick up the...
Neil, I was going to come to you next anyway. So how much of a role do you think epidemiological modelling played in the decisions that were made during the pandemic? And do you think that was the right amount of weight to put on that sort of modelling?
Yeah, I mean, it's a different circumstances from public communication and modelling. That within the UK, I mean, there was a very well-established system for scientific advice, which I'm sure you've discussed before, and SAGE and many subgroups, and then modelling, a whole dedicated group to modelling, producing, synthesising results from 10, 12 different modelling groups across the country, and that being shaped into these consensus statements, which then went forward to SAGE and ministers, together with then lots of individual bespoke work, sometimes of government departments, NHS, Cabinet Office. But I actually think we had quite an informed consumer base among the civil service and eventually among ministers. I mean, from Matt Hancock to Boris Johnson, learned to interpret modelling output. And Ben got it exactly right. The sort of modelling we were doing fell into two different broad camps. One is sort of looking backwards and understanding what happened, better understanding the science through the use of statistical and epidemic models. That tends to be important for looking for the future, but is less controversial, doesn't tend to model, policy scenarios going forward. The latter, the second type of modelling was kind of prospective modelling, both the short-term projections which were used and which are never quite right, but looking a few weeks forward, what's going to happen with current trends. And then, of course, the most controversial, but probably the most useful in policy terms, is what I would call counterfactual modelling of future scenarios. Controversial because you are looking at then different policy options and different potential evolutionary trajectories of the epidemic, and they can always be criticised, as Ben said. I mean, if you want to criticise them, you're never going to get them right, because we can't exactly predict what a policy will do, and we're not going to predict the complexity of human behaviour 3 months hence in terms of exactly what the epidemic trajectory will be. But the reason they're most useful is epidemics, just like economies and just like climates, are highly non-linear complex systems. And so intuition often fails you about what is going to happen. Just the whole concept of exponential growth is something which some policymakers and civil servants struggle with. And so on top of that, with epidemics, you have things like immunity building up. When will the epidemic peak? And so despite the fact they have many frailties, you're never going to get every assumption right. And it is very important to state what the assumptions are. Nevertheless, they're very powerful and have been very powerful tools throughout the pandemic, not just in the UK. I mean, I know colleagues across Europe, I was out in the Netherlands recently, colleagues in Denmark, also policy was significantly influenced, but not dominated, by their own modelling of the COVID pandemic. What perhaps went wrong, at least in 2020 in the UK, is that, I mean, we really didn't determine policy in some sense. Modellers and scientific advisors want to be tasked, want to be asked, this is the government giving us strategic objectives, and then we'll go away and say, well, these are the different approaches which might deliver those strategic objectives. What we failed to have really in the UK was a strategic objective for managing the epidemic in 2020. If we'd been told, given, the government's makeup, well, our number one objective is we want to have the least measures possible, but still avoid overwhelming the NHS, then you can go away and model different scenarios and come back and say, these are the pluses, these are the minuses. In reality, it tended to be a lot more reactive. And unfortunately, that meant that in some cases, the lessons weren't learned. 3/4 of the deaths in the UK happened after 1st of September 2020. So in some sense, the UK has been criticised, the government has been criticised, scientists have been criticised for the slow response to the first wave. But those same mistakes were made again in the second wave. And I don't think that I don't think that's anything to do with modelling. I think that's a lot more to do with the political environment which was in place at the time.
Great, thank you. Richard, you were doing a different type of modelling during the pandemic, which was worrying about how the economy was going to evolve. How did you at the OBR have to adapt your normal modelling approach to the great uncertainty that was?
So we had to adapt them a great deal, and I think to some extent we had to set them to one side during the pandemic, because if you think about how do conventional macroeconomic models work, well, they typically assume a fixed rate of growth in supply, and then all the shocks emanate from the demand side of the economy in the kind of classic Keynesian business cycle around a sort of fixed rate of growth in supply. They don't government, corporations, and the rest of the world, but they don't tell you, they don't have a restaurant sector, they don't have a travel sector, they don't have a financial services sector. And also, they assume that activity after a shock happens naturally returns to some equilibrium. And so supply and demand balance and the economy kind of reverts to its long-run trend rate of growth, so they're sort of mean reverting. When you try and deal with the pandemic in that context, that sort of model just really doesn't work. The pandemic affected both supply and demand simultaneously. People both couldn't go to work and they couldn't go to the shops. So you had a shock to kind of both sides of both supply and demand, and had to understand that. The shock was highly differentiated compared to the other kinds of recessions that we've faced in the past, differentiated by sector. So you really needed a model which could allow you to separately model the hospitality sector, where output fell by 90% at the start of the pandemic, whereas you had the financial services sector only contracted by 5% at the start of the pandemic. And then understanding the evolution of those sectors over the course of the pandemic was really important, how much activity was possible in different sectors of the economy at different times. And so we needed to build more or less from scratch a sectoral model of the economy that operated month by month to tell us where the economy was going to go over the course of the pandemic. And then finally, COVID was an exogenous constraint on demand. This wasn't a shock that emanated from within the economy. It wasn't a consumer confidence shock. It wasn't a sort of investor confidence shock. It was more akin to rationing during wartime. It was a constraint put from outside the economic system on the economy to try and deliver a particular public health outcome while the vaccine was being developed and rolled out. So it was really important to us to be able to forecast the economy, to understand how was the pandemic evolving, what was the timetable for vaccines being developed and rolled out, and then how effective were those vaccines going to be in allowing our economic lives to go back to some version of normality over a period of time. And so what we realized we needed to do very quickly in putting together our own forecast was, first of all, talk to epidemiologists. And so we sat down with SAGE, we sat down with SPI-M, which was the sort of modeling wing of SAGE, at the beginning of every forecasting round, to just get a sense of where are we in the course of this pandemic, what do the next few months look like, what do the next few years look like, and really just went through the same set of questions about the near term and the medium term, and get their sense of what the course of the pandemic was going to look like. We then had to break the economy down into sectors and think about, based on what they told us, how much of each sector could be open at a different point in time, sort of pre-vaccine rollout, post-vaccine rollout, and then over the longer term, how much of that sector is ever going to go back to some version of normality. And then we also had to assume a dynamic response between demand and supply, in that, as it turned out, what we discovered was that demand can recover much more quickly and much more aggressively than supply can. And so once the economies reopened, you had lots of pent-up savings in households, which was suddenly dumped onto an economy which we now understand had experienced bottlenecks from not being able to access key inputs. Logistics was a huge issue in getting manufactured goods to Western economies that had reopened and wanted to buy them. And so understanding where demand and supply were relative to each other as economies reopened was also really important. And it's something which we're still grappling with and trying to understand now as we deal with the inflationary consequences that came out of first the pandemic and now out of what's happened in Europe.
Right, thank you. Ben, are you back with us now? We can see you.
I am. I hope so. I hope so, at least.
In that case, I will come back to you. So you'd been running through your list of 5 things, and you talked about language mattering and caveats mattering, but I think that's...
Don't worry, it was only 3 things, so I'll just briefly finish off. So language really matters. Use the language of will. Don't use the language of will, use could. Caveats matter. Talk about the assumptions that are going into the model, and really take time to explain to audiences what those assumptions are, because that's necessary, I think, to build a public understanding, as I said, of what a model is and the underlying mechanisms that you're talking about, which is the really important thing to get across to audiences. And finally, I think accountability matters. So I think media and actually modelers should revisit their previous models and evaluate where outcomes actually differed from what was expected in main scenarios, and pinpoint which assumptions turned out to be wrong. Whether that's the virulence of the virus or that public behaviour was different in economic terms. And I think that's really important because it's necessary to build trust both in modelling techniques and in modellers themselves, that accountability is there, because I think this is a key point. This is a repeat game. We're going to hopefully keep using models in public policy, and we need to have public trust in them. And I think that accountability one is really important in undergirding the whole scene. So I think, I would say when I talk about models in my reporting, I try and keep to those, always try and have those three elements really foremost in my mind, because I think they are crucial in how you communicate them effectively and build public understanding of them.
Fantastic, thank you, Ben. The accountability is a great segue to come to you, Ruth, because obviously the National Audit Office play a crucial role in accountability for what government does in the UK. But you've particularly been looking at financial modelling within government. Could you say a bit about how that was used by departments to try and predict the sort of demand and spending pressures they were facing?
Yeah, absolutely. And I think maybe abstracting a little bit from the pandemic, it's probably first useful to understand that government relies on thousands of models in general to run its business. And so that's for testing policy options, understanding costs, forecasting demand, understanding risks. And they're a really important part of evidence-based decision making. And that was then even more so during the pandemic. And we look at a lot of models. We, as you say, we had this, our report we published earlier in the year on financial modelling in government. We also had a big programme of work looking at the government response to the pandemic. And I think there's a lot to dig into there, but maybe just two themes to pull out. The one is around models underpin decisions which really have a big influence on people's lives, as we've been talking about. And so it's really important that people who use those models have confidence in their quality and their robustness. And we look at a lot of models through our financial audit work and through our value for money work. And we continue to see risks to value for money from how models are produced and used. We regularly find errors in government models. And there's obviously a lot of very good practice out there, but there's also quite a lot of variability in the approach to quality assurance and performance. Things like some of the issues we've highlighted are around a lack of independent review, which can quite often lead to risks of errors. Things like inappropriate or poor quality assumptions and so on. So that's kind of one theme. And the other theme is really picking up on some of the points that Neil and Ben made earlier around sort of the limitations and the uncertainty inherent in modelling. And that was obviously even more so during the pandemic. So it's really important that model users really understand the full range of outcomes from a model. If they don't, there's a risk that the plans that they make off the back of those models might be not resilient enough or too optimistic. And then the case studies that we looked at, we quite often found that government is still too reliant on best estimates, and there's not enough. I guess there's not enough work done to develop contingency plans to take account of where there are uncertainties. And, two examples I think from the pandemic. One is test and trace. So right at the beginning, huge uncertainties in demand and the sort of the progression of the virus and what they would mean for test and traces services. And I think in August 2020, the utilization of test and trace, their contact traces went down to about 1%. But they couldn't flex staffing levels because there was too much, there wasn't any flexibility in the contracts. And it's obviously, flexibility is not free. There's a trade-off between cost and flexibility. But given how uncertain things were, that was the sort of a lesson that they learned. And then in the 2021 and 22 contracts, a lot more flexibility was built in terms of those contracts. And maybe another kind of to end on a positive note, we saw something quite good from Department of Work and Pensions, where they had developed a number of scenarios of how the pandemic would progress and what they would mean for workloads of people who were administering benefits. And they identified that there was a sort of plausible range of workloads where they might need to redeploy people from elsewhere in DWP. And so they trained those people up in advance so that they could, if necessary, deploy them quickly. So that's a really good example of dealing with uncertainty and making contingency plans off the back of that.
Fantastic, thank you. So to come to a few questions for all of you then, perhaps we can start with the question of capability within government for constructing these types of models and thinking about how to use them within policy making. Richard, I'll start with you as you're on my right. What's your take on whether government has the necessary capabilities within, perhaps we can start within the civil service, the ones who are going to need to do the legwork. Is that a strength for government?
I think we found that modelling was not so much, putting together the models was not the challenge. The software exists, you can do these things in Excel. I'm not sure what scientists in Imperial were using, but probably something more sophisticated than Excel, but you can do these things in Excel. And you can put them together very quickly, which is what you obviously needed to do with a pandemic that was moving as quickly as COVID was. I think the things which we had to find elsewhere and eventually did, but you had to kind of look in the right places, were expertise in that, we were very lucky in that we had SAGE and SPI-EMBA as groups that were already set up and people you could talk to who could give you some key judgments to feed into these models. Because big questions are just, when is this pandemic going to peak? How long is it going to take? When do you come out the other side? At what point might restrictions be lifted? And those aren't the outcomes of a model. Those are judgments you need from other people. But the other big scarcity was data, where it took a while to search around to find the kind of real-time information that you needed to just understand where the economy was at the moment. So what was your baseline starting point? I remember it was late March, possibly early April of 2020, when the French Statistics Office, INSEE, came out with the first estimate of what GDP was after a lockdown had been introduced, because nobody in the world had collected any GDP data yet. And so as soon as the French said, look, it's 25%, we've lost 25% of output as a result of basically a nationwide lockdown of hospitality and various other sectors, suddenly that just became the benchmark for everybody else to use to say, okay, a lockdown loses you 25% of GDP. Up until then, people were saying, oh, it could be 5%, it could be 50%, who knows? And then finally we had a data point to start from. And then after that, things like Google mobility data started to be shared quite widely, credit card data from how people were spending their money and how much of their money they were spending versus how much they were saving. That all became really useful inputs into the development of those models. But it wasn't so much the skills of the people that was lacking. That was definitely there. It was some key judgments and some useful information to feed into it.
And is that something you think government has now learned? Will we be in a different place for the next crisis?
I hope so. I think certainly the kind of institutional model, the institutional setups that were designed around the pandemic, I can imagine being quite useful to deal with other kinds of shocks or crises the government might face. Yeah.
Right. Neil, you were obviously one of those people providing expertise in
the UK government. Epidemiological modelling has been a strength of the UK for many decades, and some of that exists within government in what was called Public Health England. I think the challenge is with a crisis of this magnitude, or frankly, any significant crisis, anything which requires COBRA to be called, is there are always far, far too many questions to be answered. And so you need to have a surge capacity, and it isn't always sensible to maintain that within government. You may remember that something called the Joint Biosecurity Centre was created during the pandemic by Matt Hancock and DHSC to provide internal data analytics support for the pandemic response on the health side. That has now been merged into Public Health England and what's called the UK Health Security Agency. And actually, I think signs so far are relatively positive there, that they have boosted capacity beyond what they had before, but clearly they're not going to maintain it at the levels they built up in the pandemic. And so they're also reinforcing partnerships with universities, groups such as my own, in terms of responding to new things, such as monkeypox and whatever. So I think always there will be an element of internal capacity and an element of reaching out to particularly academic, and in some cases, commercial partners.
I think, just to kind of add to that, I think there's also that sort of sophisticated modelling, potentially you do need to bring in surge capacity from outside, but then it feeds into so many of the sort of day-to-day models that government then needs to, that sort of interpreting role. You take that as an input, and then you need to use that to work out what does that mean then for the demand for the services of a particular department or what a particular policy choice might be. And so you do very much need that capability within the civil service to play that translator role, and then to feed that into the very many business critical models that government has. There's nearly 1,000 that we found just in the sort of central government departments alone. And I think that the other point is that even if you are contracting out that work, that doesn't absolve the government from needing the right level of oversight and assurance to make sure that what they're getting is what they need. And there's a number of examples of where that hasn't worked so well. I think quite an example of where it has worked well is Bayes for their COVID guarantee models. So the support to business, there's a number of models which project expected credit losses from those schemes. And Bayes is ultimately responsible for the funds that have been administered under those schemes, but it's actually managed by British Business Bank. And so, in this case, the BBB ended up asking a third-party independent provider to build the model, but Bayes provided them with guidance on what kind of quality assurance they wanted. They asked for an external audit by the Government Actuary Department, GAD, and all that was what they needed to do in order to have enough confidence that they could put those estimates into their annual reports, because ultimately they are still responsible for them. So you really need strength also as a commissioner of models, even if you're not doing the very sophisticated modelling yourself in-house.
What was your overall take from your modelling review? Does that seem to be, is it usually the rule that there is that sort of capacity within government?
So I think there is, there's certainly there's a lot of expertise within government, and that's something which the analysis function and professions like the Government Operations Research Service are very focused on developing. I think the main thing that we found is that there's a lot of variability. So there are some really excellent pockets of good practice. There are some areas where it's not so strong, and there's very little central oversight of whether requirements that are set around modelling, and there's lots of government guidance on what's expected, including of accounting officers. There's not very much oversight of the extent to which those requirements are being met, and also whether there are any opportunities for learning, taking a more system-wide view and looking for pockets of good practice and then just sort of disseminating those more widely. So that's really some of the things we've been recommending in our work.
So shifting a bit of focus then to, ultimately it's really politicians who have to interpret the outputs of these types of models and make decisions on the back of that. They're almost certainly not going to be experts in any one of these areas of modelling. What's each of your takes on how, at the moment, politicians are being communicated with, and whether that can be done any more effectively to avoid what you were alluding to, Ruth, of kind of planning just on the basis of the central assumption and not recognising the uncertainty? Ben, I don't know, I mean, you've obviously had to think a lot about how do you communicate the uncertainty and trying to interpret that uncertainty that's coming out of government, and you're obviously looking at how politicians made decisions on that basis. What's your take?
Well, I think it would depend on the politician in question, Gemma. I think it's hard to know what briefing they've had from civil servants and the quality of that briefing. I think on the basis that they are, well, some of them at least are making their views on the basis of the headlines in the media, though, I think I would be quite worried, because I think this feeds into what I was saying before, but I think in headlines in broadcast and newspaper media find it very difficult to distinguish between unconditional forecasts of what will happen and plausible model scenarios, which could be averted through action. The public, and I suspect some ministers and politicians would be included in this, see a model outcome and think, well, that's what's going to happen, rather than that's something which plausibly could happen, and we need to take action to avert it happening. And then when it doesn't happen, the argument goes that, well, the model was wrong, and actually all models are wrong, so we shouldn't base any of our policy making or decisions about how we run our lives and the actions we take on this sort of science of modelling, because it's flawed. So I think, I'm not best placed to say how ministers are getting their information, but on the basis that they are, in some respects at least, similar to broad swathe of the public in the way they get their information, I would say there is a problem there. And I would go back to those three principles I outlined earlier about basically educating both the general public and politicians better about what models are and what they aren't, and the difference between conditional forecasts and unconditional forecasts and plausible scenarios.
Neil, I mean, this obviously came a lot during the pandemic of people saying, oh, but the model was wrong. It didn't happen like that.
Yeah.
What are your reflections on what have you learned from?
As I say, you're never going to be right predicting a scenario 3 months ahead. It is a scenario, and often there's uncertainty around it. So I would distinguish slightly. I think that was well communicated to government. And I think the technical civil service, Patrick Vallance, Chris Whitty did a good job in doing that. Of course, if you go into Sage documents and want to generate a Telegraph story, then that's quite easy to do, but it doesn't actually reflect very much about how those models were used. I completely agree. I mean, it is down to the politician, even a well-educated politician. I was ahead of this, I was just reflecting back that the first model of global warming, another crisis we're dealing with, was generated in 1938, first mathematical model. It was something actually predicted by scientists back in the 19th century, and most of the projections we have now were put all together in a report published in 1979. So in some sense, the science has got better and better and more certain, but you do need politicians willing to actually absorb that evidence and make policy based on it for modelling to have an impact.
Mm. Rich, I mean, you obviously do both your sort of 5-year forecasts and your much longer term projections. How do you try and convey that uncertainty and get that into policy making?
I think we do a few things. One is that, in some ways, we kind of follow the model that Sage and SPI-M followed, which is, for one thing, you crowdsource different models rather than just relying on your own. There are lots of different people who look at these issues from slightly different perspectives and come to slightly different answers. And you get a lot out of kind of putting those in a big hopper and kind of averaging them to get a sense of where the professional consensus is. And I think that helps when you're an individual modeler talking to a minister or anybody else to say, look, this isn't just me telling you this is the assembled views of everybody who's looked at these kind of questions from lots of different perspectives. And so I think crowdsourcing is important, but I think also scenarios are really important, and saying, look, if you don't buy this set of assumptions, give me your assumptions and I'll plug them in and show you that either the future looks very different or actually the future doesn't look very different. If you take a different assumption about the behavioral response, length of lockdowns, anything else. And so in that sense, I think it's also important to not just have a single forecast, but have a range of scenarios. I think one of the real challenges on your question about working with ministers and decision makers is actually to get them to engage in the downside scenarios for these sorts of things. And I think it is a tribute to Neil and his colleagues that the downside scenarios that we were looking at didn't materialize, but there was a world where when we were all waiting for the first set of results from vaccines that they didn't work. And then we were stuck in a scenario where we basically had to adapt our mode of economic life to something very different from what existed before the pandemic. And we did get lucky. And there wasn't a lot of sign of, in any country of anybody actually preparing for that downside scenario where vaccines didn't come along. So I think to some extent, lots of countries had economic strategies for the central scenario and for the sort of upside scenario where vaccines were even more effective than we'd hoped, which the one we sort of turned out to be in. But nobody really had a plan for the downside scenario.
Mm-hmm. If I can come in on that one, I think it's also about how those scenarios are then converted into contingency plans or kind of the policy response, and that is something that we have found that systematically there have been weaknesses in a lot of our work. So when we think about major projects, we often find that there's sort of insufficient acceptance of the levels of risk and complexities, particularly in early estimates, and so there's not enough contingency allowed. When we looked a lot of our EU exit work, we found that quite often, the civil service could have dealt with uncertainty better. For example, developing multiple scenarios about what potential outcomes could be, and then developing contingency plans to address those, not just the scenario that was the preferred one. And I think that's also come out to some extent with COVID, where there wasn't necessarily a playbook to deal with many aspects of the COVID response, even though pre-pandemic planning had often identified those issues as something which might need a response that they weren't in place. So it's also translating that uncertainty then into some kind of action or response.
And is your take on it that that's a problem at all layers within government? So it's not just that ministers aren't giving civil servants the steer to prepare that contingency, it's also that lower down through the civil service they're just not anticipating that, they're not pushing the need for that.
I think there's an undue focus on best estimate. So a lot of information is presented as a best estimate, and if there is uncertainty analysis, it's often buried in an annex. So the starting point is actually making that information available as part of the core message. There's a nice example that when HMRC present their tax credits fraud and error estimate, they present that with a central estimate and then a 95% confidence interval around that. But that's part of the headline. Like that's the way in which you receive the information rather than buried separately. So I think in general there's a lot more that can be done. And one of the recommendations in our report is that while the Treasury as a big user of government of outputs from models could do more to really encourage that type of analysis. So generally the initial submissions to Treasury are in the form of a best estimate that departments make, and then often there'll be a challenge process after that, and on a case-by-case basis, the Treasury will dig into those estimates. But what we've recommended is that as a matter of course, Treasury requires information to be presented in the form of a range of outcomes with obviously the most material sources of uncertainty. So there's things which commissioners of information within the system can do to improve things.
Right. I mean, one thing that was quite striking during the pandemic was the different degree of transparency around different types of models that were informing government policy. You had huge transparency in a way around the epidemiological models that were going to SAGE, and absolutely no transparency around the economic models that were informing parts of what government were doing. What do you each think about that? How valuable is transparency in helping people to understand and improve the quality of the modelling anyway? And what does stand in the way of providing transparency about all of these models, not just the epidemiological ones? Richard, perhaps I can start with you.
I think it's hugely important to be transparent about what you think is going on, B, how you then set up the models to predict what you know about the present could mean about the future, and then B, the errors and different possible futures that you could end up in. I think from the OBR's point of view, we did that as early as April 2020. So within a month of the pandemic sort of hitting, or lockdown starting, we tried to create a set of scenarios and publish them so that people could get a sense of what was going to happen. And I guess particularly in the context of a novel crisis like the pandemic, it was important not just for government but just for people to understand what the economic consequences could be, and that means people to make their own decisions about their own economic lives, businesses to make their own decisions about how to run their businesses. And you saw the reaction that economically you saw the reaction people had to just getting more information. Over time, they managed to adapt the way that they behaved. They found ways to get back to work. They found ways to shop online rather than shopping, waiting for the shops to reopen. And so providing information in the context of a crisis is really important because it allows people to adapt their behavior to the crisis and do some kind of planning ahead, which people couldn't do early on in the pandemic because people just didn't know what the future was going to look like.
Do you have any sense, one of the other things that you do in your longer term modelling is things like climate change modelling. Do you have any sense that sort of modelling affects behaviour over longer periods of time?
I think so, although with the caveat that Neil makes that it can take a very long time for the results of that kind of work to filter into people's understanding, and it probably is. It can be weeks, it can be months, it can be decades. And to some extent, people wait for sort of confirmatory events, and I know we're not supposed to associate higher temperatures today with what's coming out of the modelling from climate change, but to some extent people wait for a handful of reads which actually confirm what the model has been telling them before they start to believe the models. So I think it can take a bit of time to get some kind of reaction.
Ben, as a journalist, how much do you think transparency, because I mean in a sense there is a potential danger to government of being very transparent about things because people might find things that government didn't want to be open about. Overall, it does really help with the quality.
Well, yes. Yeah, I would always urge government ministers to urge, and civil servants actually, to urge on the side of transparency for that reason of public trust, which I mentioned in my initial remarks. It's interesting. I think transparency is so important for the public trust, but transparency not about just what is being modelled, but what isn't being modelled as well. There's a speech which I think has just come out from Claire Lombardelli, I think is the chief economist at the Treasury, about the Treasury's use of economic modelling in the pandemic. And I think it's really interesting because I wasn't quite clear at the time, but she's saying that they didn't model the economic impact of lockdowns because they couldn't come up with a reasonable counterfactual about what would happen if you didn't lock down. They didn't feel they had that counterfactual, that they could produce those kind of quantified numerical pounds and pence estimates of the impacts of lockdown, which is perfectly fine. But it would have been useful to know that at the time, when there was a lot of talk about the Treasury suppressing impact assessments or suspicion of this happening because it showed such dire impacts. So transparency, not only about what the assumptions are going into your models, but what you've chosen not to model, is really, really important in these circumstances where people's livelihoods are at stake, is the point I would make.
Yeah, I mean, it's a very interesting speech that you refer to there, Ben, giving a bit of insight into what the Treasury were and weren't doing during the pandemic. I think there was one interesting point that came out of that from Claire, who was saying essentially those detailed models were incredibly uncertain. We didn't know what assumptions should go in, and that they didn't felt that those models got them really any further than the basic intuition that you would have, which is interesting in what you were saying, Neil, that actually you think basic intuition can fail you with some of these types of models.
I think it depends on the stage. So arguably that is true back in March 2020. You have hospitalizations doubling every 3 days. You have a disease with a certain lethality. You can actually do a very simple model to say, this is going to be very bad if we let it continue. Where it becomes much more complicated is you have immunity in the population, the virus evolving, you're rolling out vaccination. Their intuition does start to fail. Coming to the transparency point, I mean, thinking back all the way back to March, April 2020, there was a lot of criticism of government in terms of you didn't even know who was on stage, modelling wasn't public, and so that did change radically over the pandemic. In those first few months, more than anything else, there are some caveats to it, particularly at times where you have enormous amounts of uncertainty. You can be generating some quite scary, and we were generating some really quite scary scenarios back in February of 2020. And we had no time to carefully spend days, coming up with a document which presents all the uncertainties around it. I mean, working in real time. Coming back to Ben's bad actor point, if they'd just been thrown into the public domain, there would have been some consequences to that. Undoubtedly. What Sage moved to was this basically putting somewhere between a 2 and a 6 week delay on release of documents, just to allow that internal private discussion time without having this parallel discussion in real time in the media about which isn't always constructive.
I think what we found, as an auditor, I'd obviously say transparency is hugely important. It's a really important tool for scrutiny and assurance. But I think also we found that during the pandemic, it can also act as a really vital control for accountability, where some of your other controls perhaps aren't in place. So, perhaps you don't have the time for competitive tendering, but transparency on decision making acts then as a really useful control, and the points around public trust that Ben's made as well. And it's really clear, I think, from government guidance that transparency is expected. In fact, it's in the guidance to accounting officers managing public money that transparency should be the norm when it comes to models. But actually, that's just not the case. It's very hard for the public and Parliament to find out information about models. So the COVID modelling was actually quite unique in that respect. We looked at a sample of about 75 models in our work, and we found no information at all in the public domain on 45 of those. And then the rest, there'd be a spectrum from just bare details to the full model itself published. And we also, when we looked at the registers of business critical models that government departments had, only 4 departments had updated theirs since 2017. So not very much out there. And we recognize there's a cost to transparency. It's expensive putting things out. You've got to do the legwork, as Neil said, to sort of explain the caveats and the limitations. And so there will be a range of variable public interest in publishing things. And so we've called for the analysis function and for Treasury to really make it very clear what are the principles under which you'd expect departments to be making things transparent and available, and how far do you need to go?
And actually, I'll just follow up with you because we've had one question come in that sort of follows up on that point. Just asking who's responsible for doing that sort of communication for the the informed, interested member of the public to understand what the models are doing?
Who should be responsible for the publication?
Yeah, yeah.
Well, I think it's individual departments, which is why it often ends up falling by the wayside. It'll depend on the discretion of individual ministers. But really, it's a standard expectation that it should be the norm, unless there's compelling reasons for it not to be. And that's why having a clearer set of principles under which it's acceptable not to be transparent for whatever reason would be really helpful. And then again, as we talked about at the beginning, that oversight then of the extent to which those requirements are being met and adhered to. And we think there's a role there for the functions, particularly the finance function and the analysis function, to build that into their assessment frameworks that they have around their functional standards, to actually help departments understand how well they're doing against the requirements of the standards.
Fantastic. I should just say, Will Moy from Full Fact did ask about what stands in the way of making government models public. So I think I have covered his question, but it was a very...
It is costly also. So there's an expense to this. So there is a trade-off here. But I think it brings enough benefit that it's worth it in most cases.
Great. Question from Tom King, tuning in from Newcastle upon Tyne. To what extent can the uncertainty in models help understand exactly what data collection is needed to improve understanding and include supporting dynamic evaluation? Richard, I'll come to you first because you touched on this already.
I think that they can, and if you think about the way that traditionally in economics you present uncertainty, is that you rely on fan charts which are based on past forecast errors, and that approach to uncertainty was basically completely useless during the pandemic because the future was going to look nothing like the past, at least for a period, and it was very much going to depend on a set of variables which weren't dictating the course of GDP, consumption, or anything else. And so you had to rely on specifying uncertainty based on the values of particular parameters. And the key one was, how effective was this vaccine going to be in allowing our economic lives to go back to normal? If it was very effective, basically the economy can go back to something very close to what it was before. If it was not, then we had to have a different kind of economy and a painful process of adjustment to that, most likely. Once we had a read on the value of the effectiveness of vaccines, suddenly we knew which one of those worlds we were more likely to be in, and you could put more weight on one of these scenarios versus the other. So really important.
Ruth, from your work, I mean, is that a dynamic process that happens within government to try and improve models?
Well, it certainly should be. So, we recognise that certainly at the start of the pandemic, there were trade-offs between value for money and the sort of the speed and the scale of response that was needed. And so we've tried in our audit work to really look at how well those trade-offs were understood and managed, rather than trying to look with kind of perfect hindsight. But I think where it's apparent that there is uncertainty, and it's not clear what the best approach is, it's having that iterative, that feedback loop, to monitor and to understand, what new information might then help you to calibrate that your approach and your views. For example, I know ONS put in place their new business, a survey looking at sort of impacts of COVID on business directly as a result of a clear data gap in some of the models. So you really need, even if there's insufficient information at the beginning to make a really good decision and you still have to act, there's no excuse then for not, as things progress, trying to fill those gaps and improve the modelling and the assumptions.
Yes, it's been critical throughout the pandemic. Right at the start, assessing the severity, what's the infection fatality ratio of this virus, that came to be important again with the Omicron wave, where all the different models were saying we're going to have an enormous wave of Omicron infection, but we don't. We had some anecdotal reports from South Africa, maybe milder. And that then you jump into doing what I spent most of December doing, detailed data to actually get estimates of severity. Other examples, early in the pandemic, we didn't really know how many people were being infected. Most people weren't being tested, but even when we started handing out tests, probably only a subset of infected people got tested, and that poses real problems to tracking immunity in the population, really knowing how large the epidemic is. And so things like the ONS infection survey were created to address that specific gap and inform, to some extent, inform modelling, but really inform decision making.
Ben, do you have anything to add on that one?
No, not really. I mean, I just want to briefly come back to this cost-benefit point about transparency. I mean, in terms of, we've seen how important public reaction is in influencing outcomes. So if you get a situation where you can get good information to public and to the public through timely release of data, it's definitely worth it, I think, because that influences how people act. So yes, there may be a cost in producing this information, but if you think about the whole ecosystem, if you like, and the whole scheme of things, I think the benefits are very much weigh on the openness and transparency side of things.
And a shout out for things like the Science Media Centre, which I think during the pandemic did a good job in conveying both science and modelling.
Ollie.
Hi, Ollie from Chief of Government. I've got a question, I think, probably mainly for Ruth, but the others might know something about it as well. To what extent do you think the sort of reliance, particularly in departments, on central point estimates might be linked to capabilities within the civil service, resource devoted to resilience and preparing for sort of worst outcomes? I mean, to what extent are departments, I guess, slightly restrained in that they only really have capacity to focus on sort of the central case and not a huge amount of resource to devote towards emergency planning, risk preparedness, that sort of thing? Thanks.
Yeah, great question. I think we've just produced some work on sort of preparedness and resilience in the civil service, where we think there is quite a bit more that can be done. I think there's certainly a cost dimension to this, a capability dimension, and also a cultural dimension. So, we find that uncertainty analysis is much easier done if it's done by design. So if it's built into a model from the start, you can automate quite a bit of it. What we heard of as barriers were time, difficulties in knowing what was possible with particular software, but mostly it was the sort of the demand for that analysis, demand from the top. So I think it's it's a range of things, but the starting point is that perhaps there's insufficient demand for it, which is partly why we've called, we think a lot of the culture in government can be set by what's demanded essentially, which is one of the reasons why one of our recommendations is for Treasury and indeed the OBR to sort of make more not accept central point estimates as a sort of matter of routine, ask for more information from departments in the hope that trickles down furthermore into what departments do then on the ground.
All right. Does anyone else want to come in on that one? In which case, got another question in the room.
Yes, we see that modelling is very important. We hear about it in reaction to events happening, such as COVID. What difficulties or challenges do decision support advisors have in, should we say, pushing models which look at weak signals as something that may or may not happen, particularly in line with what Ben was talking about earlier, to keep weak signals floating up there somewhere without actually getting big loss? How does, and if you don't do that, then you're always going to be taken by surprise by some unexpected event.
Right. Richard, you've just published a report on lots of the big risks out there.
It is, yeah, and I think to some extent, so we've been producing a report in the OBR called the Fiscal Risks Report since 2017, and it's precisely aimed at trying to get at this idea that basically the future is much less certain than you think. There is a tendency toward wishful thinking in fiscal policy making to always hope for the best, but not do enough planning for the worst. And I think to some extent, the pandemic has helped that endeavor by just showing that catastrophic risks are real. Things that can have very big impacts on GDP, add a lot to government deficits and debts, do come along with more, they are both more severe and more frequent than you think. And I do think that a change in mentality that needs to happen in the 21st century is just to accept the fact that it is a lot riskier than what we got used to experiencing in the latter part of the 20th century, which was steady growth, with short, sharp recessions, which then recover to periods of otherwise steady growth with low inflation and full employment. Instead, we've had a financial crisis, we've had a pandemic, now we've got a war in Europe and an energy crisis. All these things have been very damaging to the economy. They've been very expensive for public finances, and they're the sorts of events which, when you're a fiscal policymaker, you need to keep in mind that you don't know what the next thing is going to be when it comes along, but it will almost certainly come along at some point, and you need to aim off for that actually arrive.
Neil, do you have any reflections on how you...
It is, I don't have a simple answer. I mean, it is, I think you almost need to cost the risks and the financial costs of crying wolf. I mean, because we did see this at the beginning of the pandemic. In some sense, I can look back and say our very uncertain estimates of severity, transmissibility we had in early February basically told us what was going to unfold from then on. And I should have been, colleagues of mine would indeed believe this, I should have been jumping up and down. We should have locked down, sealed our borders at that point. But that you're dealing with immense amounts of uncertainty, fourfold in each direction, maybe even tenfold, based on tiny amounts of data. I don't have the right answer to that. In some sense, you want to cost, well, what would have been the economic cost of getting that wrong? I mean, the political cost would have been huge, but even just from an economic perspective, calling that sort of decision wrong has a cost, but it also has potential benefits. And in theory, there could be some research around that. The practicalities of it, though, and the politics of it are completely different. I mean, I doubt ministers would have moved at that point, given that level of uncertainty.
Ben, do you have any thoughts? I guess as a journalist, you have a choice about what to cover, and how do you think about these?
Yeah, I mean, I think it's sort of the tail risks, if you like. I think I always like to think when I'm talking about economic data, we don't always have it for a very long period. So we're talking about maybe 100 years for GDP data, and that's sort of backward created, and labour market data, we don't always have it. So I think as a journalist, I always like to say, well, we haven't seen anything on this scale on the data that we have. And sometimes that data only goes back a short period, sometimes it goes back further. I think specifying the period over which you have data and which you can make a claim about something's likelihood is quite important, actually, and probably not done often enough.
Ruth, do you want to add anything, or go?
No, I think it's been largely covered. I mean, I guess maybe just to say that it's that point around contingency planning and the importance of proper risk management, and that, while government can't prepare for every eventuality, it's about having a good awareness of what are the scenarios that are plausible and have a high enough potential impact that it's worth preparing for. And what we found when we looked at pre-existing pandemic preparedness plans, they didn't have adequate plans around things like shielding or unemployment support, or indeed, take into account sort of the mechanisms to compensate local authorities for a drop in income. So even though DLAC, which is the Department for Communities and looks after local authorities, had stress tested local authority finances to economic shocks, what they had stressed, the actual economic impact of the pandemic far outweighed anything that had been stress tested. So I think it's in general, it's not necessarily about preparing for every single risk, but thinking about the types, the categories of impacts which could result from a range of different risks, and then having some kind of plan in place for those. That's really important.
Right. And probably final question, I think we're going to have time for.
Thank you. So you mentioned the estimates about the drop in French GDP, and if modelling is about closing or shrinking the gap between the sort of possibility and the probability of something, to what extent are cognitive biases built into models, because modelling teams are human beings, and things like framing or anchoring, and is that something that you have a particular view on?
Neil, do you want to start?
I mean, yes, I think it is a risk. Did it play out in the pandemic? Maybe to a degree, but it's certainly a risk we're conscious of, and even groups such as SPI-M and SAGE have that same risk of let's say, groupthink or this affirmation bias. it is a difficult thing to completely disregard. I would say it didn't. I think in some of the external public debate, I've been accused of wanting to retain political power. Well, I never had political power. I think the cognitive biases are not around policy solutions or policy options, or that epidemiological modelers wanted a particular outcome. They're more subtle than that. They're more along the lines of all scientific researchers, as once you've come up with a set of estimates, and a belief that this is how the system is operating, it requires quite a big shove for you to change that. We're not perfect absorbers of information and processors of information. So it's less on the political policy side, much more on just how much information it takes to change people's perspectives on the drivers.
There are some things that you can do, though. So, there's good practice ways to try and mitigate some of those risks. One is comparing, modeled results to actual outturn results, and that's something which the OER does with the forecast evaluation reports. Other thing is really inviting scrutiny of assumptions from external stakeholders to get that challenge. So there are things that you can do to help improve that.
Yeah, there's the kind of red team. So the US didn't actually use it this time, but in the 2009 pandemic, I was on various government advisory boards in the US as well as the UK, but I was on particularly the CDC red team. And there, that's a deliberate or parallel advisory structure which is put in place to challenge, the dominant view, let's say, and provide constructive criticism, let's say. And there was an element of that within the UK advisory structure, but it wasn't a well-defined role.
And I think you definitely saw examples of what you talked about during the pandemic in terms of our economic understanding of it. And the best example is perhaps we had 3 lockdowns over the course of the pandemic. We saw the first one reduced output by around 25%. Everyone's expectations when the second lockdown came along in December was that it was going to be another 25% fall in output. But actually, what everyone underestimated was how much people's behavior had adapted to lockdown conditions and how much of the economy could actually stay open in one form or another, either electronically or through delivery between the first and second lockdown. So the second time around, output only fell by around, I think, 11-12%. And then by the time of the third one, the fall in output was only in the single digits. And consistently, economists, including ourselves, underestimated how adaptable the economy proved to be to these kind of restrictions, because economies are dynamic systems. People learn from experience, and so in that sense, getting preoccupied by one particular data point and thinking that the future is always going to be like the present or the recent past is a mistake that one always has to make, and you have to always sort of revisit your priors when you get new data.
Ben, do you want to add anything on that?
Yeah, I would agree with everything that Richard and the panelists said. I think biases and groupthink unconscious biases and groupthink are inevitable. But yes, transparency and clarity about assumptions enable others to sort of spot them. And also, as Ruth said, retrospective evaluation of your things, that's a learning process. So I think these are inevitable things, but we do have very good tools for confronting them and addressing them.
Fantastic. Well, unfortunately, we are now out of time, so huge apologies to those of you who sent in questions that I didn't manage to get to. But I hope you have all enjoyed what I thought was a very interesting discussion of these issues, and something that government will continue to have to grapple with, and hopefully be taking on board lots of the lessons that Ruth's report and others have been highlighting. Just to say a huge thank you to your panellists, to Ruth, Neil, Ben, and to Richard. Please, if you have an audience, give you a proper clap. And thank you very much to the Forum at Imperial College for supporting this, which is the last of a series of 5 events. The others you can find the recordings of on our website if you missed them live at the time. But anyway, please do join us again for the next IFG event. But thank you very much. Thank you.